Sure. Thanks, Megan. And thanks for that wonderful introduction. When it comes to brain health, stress is one of those things that we are always, I think, and what we're going to talk about today, right? The goal of protecting our brains from stress actually isn't to get rid of stress. We can't get rid of stress. Um, However, we can manage it. We can make sure that we're kind of in an optimal stress zone, which is something that is actually kind of good for our cognition. Where we get into trouble is when we're too stressed for too long. So things like chronic stress can really impact us. And so I think it's really important just to have conversations about what constitutes bad stress and then how can we actually protect ourselves against it. So I'm hoping that our talk today will be really helpful for that. Um, as Megan said, if folks have questions as we're going, please feel free to drop those in the chat. I want to invite you to ask your questions. I can't promise I'll know the answers, but I'm always happy to tell you what I do know, or give you some resources for where to go. And then Megan, if you don't mind kind of keeping an eye on the chat, that way if there are questions as we go, I'm happy to answer those kind of in the moment.
Yes, I'll be monitoring the chat throughout the whole session. If you send anything, I'll be answering right back. So I will be there in the chat start to finish, everybody.
Perfect. Thank you. All right, guys, so let's go ahead and jump in and talk a little bit about how we can protect our brains from stress. So just as Megan said, I'm a neuropsychologist by training, which just means I'm a clinical psychologist, but I have a specialty in brain health. And so that's where some of my psych skills today will be coming in when we're talking about stress and stress techniques, stress management techniques. Um, I am both at the Brain Health Center and also at the Cognitive Empowerment Program. So if folks have taken part in that program, you have probably seen me, maybe too much. We'll see. All right, so let's talk a little bit about stress. So what we're going to cover today, first we'll talk about effects of stress on the brain. We'll talk a little bit about how we can identify stress and particularly chronic stress, which is some of that bad stress that we really don't want. Um, and we'll talk about some of the risks of that chronic stress on brain health. And we'll spend a lot of time today actually talking about some strategies for how we can manage or mitigate that stress. So as I said, please feel free, to ask questions in the chat as you have them. And otherwise, we're gonna keep moving. So, a big part of brain wellness is stress management. So, I'm sure everyone can think about their day-to-day life. There's a lot of stressors for most of us. I don't know very many people that would say that they have a stress-free existence. Most of us are managing multiple stressors each and every day. Some of those might be really big stressors, some of those might be really small stressors. And there may be kind of an additive effect of these, right? So we have to really, the world that we live in, I think, is really stress prone. So let's first talk about what stress is. Stress is a normal response to the demands of everyday life. This is really important. So our goal is never to fully get rid of stress. Stress is important. It actually kind of drives us to do things that, help us align with our goals and our values. It can kind of give us that get up and go for something that we know is important, but maybe we're hesitating to do. So stress is not always a bad thing. However, there can certainly be bad stress. And so you can see in the picture on the screen, the idea here is that, and this is a kind of well-treaded area of research, that what we tend to see is that there's kind of an optimal level of stress. So across the bottom, you can see increasing stress levels. So all the way to the left in that kind of green area is someone who has too little stress or kind of no stress. And then all the way to the right, we have that red zone, which is burnout, and that's way too much stress. Now, on the basically what we can see is that as stress increases, there's actually a point at which we kind of hit this optimum level of stress. The idea there is that when we're in that optimum stress zone, we're being productive, but we're not feeling exhausted or burned out. So we're doing the things we need to do, but we're not actually dipping into that really bad stress that can be kind of bad for our brains. So this is a totally normal response, right? We need some of that stress because if we're spending all of our time in this green zone, we might not be getting done the things that we need to get done. But finding that optimal stress zone can be difficult. And we certainly don't want to spend too much time in the kind of orange and red zones on this graph, because that's when we start to get chronic stress that is really bad for us. I will also say, I'm sure, you guys can think, I'll ask in a minute, what some strategies people have are, but when we start to get into those kind of orange and red zones, that's when we want to really start applying strategies for managing our stress to make sure that we're not staying in those zones for very long. It's totally normal and expected that we're going to dip into those zones every once in a while. But if we're starting to feel a lot of anxiety or panic or anger, or feeling like we're just really exhausted, that's a time when we want to think, okay, I need to take a step back and think about what I can do to lower that stress because I'm spending a little bit too much time in that kind of bad zone. It's important to keep in mind that the length of a stressor really matters. So, nonstop stress is really exhausting to our body and to our brain. So, we're pretty good at managing even really big stressors that resolve quickly. So, you can think about something like if you were to get into a car accident, that is a huge stressor, right? That's a lot of stress that you're taking on in the moment. Those tend to resolve quickly. So, that might be a week or even 2 weeks where you're having difficulty with that, but then it gets better. And that getting better is restorative for us. Chronic stressors, things that we're dealing with for months or years that are kind of unyielding, they're not getting better. That's when we start to worry a lot about this kind of nonstop or chronic stress. So I'm hoping that I've convinced you that the goal here is not to get rid of our stress. The goal is to manage it and to kind of keep ourselves in those green and yellow zones as much as we can. And that's what we'll be talking about in terms of strategies. Um, and then people may have heard these terms before. I know I've been saying chronic stress. I just want to give you guys examples of what acute or short-term stress versus chronic or long-term stress are, just so you have a sense as we kind of go through the presentation. So, acute stress is a response to a short-term stressful situation. This is going to be something like if you have to make a speech, maybe you have a big event coming up, something like a family reunion or something where you're really concerned about being able to, you're going to be seeing a lot of people, maybe you're traveling for it, something like that. These are short-term stressors. The idea is that no matter how stressful they are, they're time limited. They get better quickly. And the stress will end when that situation ends. Chronic stress is something that lasts for days, months, longer. These can be things like unhappy relationships. These can be things also like caregiving. We know that that's a common chronic stressor. But the idea here is that the stress is continuous or it's recurring. So even if it subsides, it comes back. And that chronic stress, that's what we really are thinking about when it comes to our brain health. That's the stuff we really want to mitigate. We can't really, we can't always manage acute stressors or short-term stressors, but we can do a lot to manage our long-term stressors. So this becomes really important. Managing that chronic stress becomes really important when we're thinking about our brains. So there's been a lot of research on the effects of stress on our brains. Unfortunately, what we know is that that long-term chronic stress can have a big impact on things like our thinking skills, and on the quality, the health of our brain. So we know that stress can interfere. And when I say stress here, I do mean chronic stress. Those acute stressors are probably not going to impact your brain in this way. It's those long-term unyielding stressors. So chronic stress can interfere with things like your ability to pay attention, your ability to remember information, and generally they affect our overall thinking skills. So people do find that, when they're under chronic stress, that can certainly impact kind of your overall thinking, and it seems to really impact your attention and memory. We also know that stress can increase anxiety and depression. So people who are under chronic stress are at higher risk for developing anxiety disorders and depressive disorders. And those things on their own are problematic. That's something that you certainly would want to solve. But those things also contribute to poor brain health. So if we're spending a long time with anxiety or depression that's not being treated, that too can then impact our cognitive health. So things like our memory and our attention. Importantly, there's also been research that has shown that prolonged stress or this chronic stress is a risk factor for dementia and is associated with people converting from mild cognitive impairment into dementia. So if you're someone with an MCI or mild cognitive impairment diagnosis, it's really important to manage that stress because the more chronic stress you have, the higher your risk goes for having continued decline or for having more decline. And I won't spend too much time on the actual kind of neuroanatomy of stress and things like that in the brain. But I will say this chronic stress can lead to things like inadequate sleep, poor nutrition, emotional distress, things like anxiety and depression. And then that kind of starts a loop that is really not good for our brain. So what that does is it increases something called glucocorticoids, which I won't go into, but it's something that's important for things like memory in our brains. As that goes up, changes happen in our hippocampus, which then causes problems with our cortisol, and this loop just continues. So once we get into that cycle of chronic stress, it can be really hard for our brains to kind of stop that cycle. We really have to manage the stress. And as I said before, we start to see changes in things like attention and short-term memory. People can have difficulty with learning and word finding, and it can even sometimes impact people's ability to correctly perceive situations. So it's really important to manage stress when it comes to the brain. And, when we think about stress, one of the first things we can do, and maybe one of the most important things we can do, is to increase our ability to identify our own stress triggers. So everyone in this room, in this chat room, has probably different stress triggers. There may be things that you find really stressful that other people don't. I think there are some universal stressors, which we'll talk about, but it's really important to know for yourself, what are those things that kind of push you into the orange and red zones on the stress scale? What are those things that really stress you out or that feel really unyielding, that feel like they just kind of never go away? So when we're thinking about stress triggers and the things to kind of look out for, we want to think about both external factors and then also internal factors. So external factors are going to be things like things that are in our environment. They might be life changes. They might be family changes or family relationships. They could be unpredictable events. That kind of goes into environment too, right? I know there's been, if there's a flood in your area, that's going to be something that could be a chronic stressor for you. Social activities. So even though social activities can be really good for our brain, if that's something that's causing you a lot of stress, that might be something that you want to think about. Okay, how do I do this in a way that reduces stress? All of these things are external because they're happening outside of us. They're things that we're having to really react to. They might be happening in our environment, our social lives, our homes, things like that. But we're sort of separate from that stress. We're having to really react to it. In addition to those external stressors, the things outside of us, there's also internal stressors. These can be things like fears, feelings of uncertainty, and also our own beliefs. All of these things can cause us stress. So when we're thinking about managing stress, we want to, be pretty concrete about thinking about what are those stressors? What are those things in my environment or my external space, and also in my internal space that are causing me to kind of choose something over again and again, or, I'm having to continue to kind of work on this over time. And we want to think about those as places where we might be able to manage stress. I do also just want to note there are some factors that can make a trigger or a stressor even more harmful. So I know we've been talking a lot about how, there's not always this opportunity to change a stressor. Sometimes, we live in a world where there are a lot of stressors all the time, and some of those we manage better than others. However, when we're thinking about those triggers or those stress factors that might be really harmful to us, the things we want to think about are first, when stressors are really unpredictable, it can make them even more stressful, more chronic, and more harmful. So if we're able to anticipate something, if we are saying, I know that my family reunion coming up is going to be really stressful, but I think I can, reduce some of my stress while traveling by traveling with a friend, or I can reduce some of my stress by practicing ahead people's names and making sure I have their photo in my phone or something. There are things you can do to manage big stressors if they're predictable. Things that are unpredictable tend to be more harmful for us because we're not able to anticipate them. We're not able to kind of pre-manage that stress. We have to just kind of deal with it in the moment and then hopefully resolve it quickly. Another thing that can make stress more harmful is when there's no time limit on the stress. I'm sure people can think of specific examples of this in your own life where, something may not have felt too stressful, except that you didn't know when it was going to end. So for example, if you're being asked to pay extra on your utilities bills, you can do that for a couple of months. You can plan for that. You can say, this is okay. I know this bill is going to be a little bit higher for a couple of months and then it will subside. I can plan for that. If, though, you have a huge jump in that bill and then you don't know when it's going to end, that becomes a lot harder to manage. You're not really sure how to prepare for it or plan for it. So, when there's no time limit on the stress, that can make it a little more harmful. It can make it more likely to be a chronic stressor. And then the other factor that's very changeable, that's something we can actually do, is if you lack strategies and support, we know that those stressors can be more harmful. So it's really important that if you don't have strategies in mind or support in mind for when those unpredictable or really stressful events happen, that's a time where we want to put online some strategies and support. And I've got some ideas for you a little bit later in the session. So if you're someone that's sitting here thinking, I'm really not sure what I do to manage my stress, hopefully we've got some ideas for you. I also just want to call out for people in the audience that have a diagnosis of mild cognitive impairment that, you may already be thinking about how some of the things that I've mentioned might be stress triggers are kind of part and parcel to having something like MCI or having a chronic illness. So with MCI, that in and of itself can cause stress. So a lot of people feel a lot of stress around the time of their diagnosis because it's really unpredictable. It might, it kind of adds this new stressor that, the time limit on it is unclear, the outcome is unclear. There's a lot of uncertainty. And then also living with mild cognitive impairment also has kind of its own stressors. So things like feelings of denial, feelings of fear or loneliness or frustration can be common in mild cognitive impairment. There's also, something that some people experience as they're going along in their illness journey is a loss of self or a loss of identity or a loss of independence. And it doesn't have to be a full loss, right? Even shifting some of that independence or finding that there are things that you used to do or used to enjoy and now that's really hard for you to do, that can be a source of chronic stress. It's something that you're not able to do anymore that you used to be able to do. It's also not uncommon for people with mild cognitive impairment to have things like depression, both in response to changes that are happening, but also as part of the changes that are happening. So that increase in the rates of depression in the mild cognitive impairment group makes it more likely that folks will experience chronic stress in that group. And then MCI can also result in things like anger or frustration. So those changes that can happen as part of mild cognitive impairment can also lead to those feelings of anger or frustration, which kind of ticks us up even further into that orange and red zone that we were talking about earlier. So I just want to acknowledge that because, certainly if you're someone that's living with mild cognitive impairment, I think thinking about reducing stress or managing stress is really something that's critical at this point. So, I'm hoping we can sort of interact a little bit here, but I'm curious, what strategies are people already using to manage their stress? And feel free to drop it in the chat. Are there things that people are already doing that they feel like are working really well? Also, feel free to drop in the chat if you're like, I don't have a strategy for this. And I'll give folks a couple minutes just to drop some of that in the chat, and I'm going to take a look too. Exercise, yes. Journaling, good. Yes, I love it. Um, So exercises, we'll talk a lot about this here in just a minute. Oh, meditation, yes. So we'll talk about, I think these are all in here. Exercise can be incredibly powerful. It has kind of a one-two punch, right? So it's really good for our brains in and of itself. And it can also help us reduce depression, anxiety. It can help us reduce stress. So if you're someone that likes to exercise, that can be a really great option. Absolutely. So journaling, meditation, anything that lets you kind of work through the stress that you're feeling is perfect. Phone games. Okay, I love it. Yeah, anything that's kind of helping you unwind and step away from that chronic stress is going to be good. Salima says a day trip to a casino. That would definitely help kind of get you away from that stress. It might also cause some additional stress if you're not very good at the games, but that's its own issue. Nancy says gardening, absolutely. Praying, absolutely. Humor, I love it. Good. Yeah. So these are all wonderful ideas. I also see someone, so Nita said chores. Certainly, right? So for some people, it's kind of interesting because we tend to think about things that manage stress. So when we think about strategies for managing stress, we're often talking about things we're kind of adding, right? So we're talking about adding exercise, adding journaling, adding meditation, those types of things. But for some people, managing that stress can also mean taking away something that's causing you stress. So if you feel more stressed when your house is really messy, doing chores to help manage that stress. Maybe you like pop in some headphones and kind of check out while you're doing it, but it helps kind of, clean up your space, reduce clutter, that type of stuff. That can actually kind of give you, it can kind of pull you back from some of those feelings of exhaustion and fatigue as well, to have some things checked off of your list. Um, Wonderful. So thank you guys so much for all of these great ideas. All of these are great. And I think we're getting to kind of the heart of this where I want to reflect back that part of this is finding what works for you, right? So I'm sure as people are looking through the chat and seeing things, there may be things that you're like, oh, that wouldn't work for me. That would feel very stressful to me. Um, that's normal, right? We don't all have the exact same kind of makeup when it comes to what helps us with stressors. So, what's important to keep in mind there is that, you may have to go through a couple of things if you don't already have strategies in place for what is going to help you reduce that stress or manage that stress. So, don't shy away from that. If you try something, for example, if you try something like journaling and you think to yourself, you know what, it actually feels more stressful to have to kind of have that on my schedule, that's fine. Step away from it and try something else. So find those things that work really well for you. When it comes to stress management, a lot of it is really individualized. But the idea is that, again, we want to just kind of move ourselves out of that orange and red zone into more of a green and yellow zone where, we might have a little bit of stress, but it's manageable. We feel like we're getting things done. So you guys have already provided wonderful examples. However, I want to just kind of talk about some of these. So this is obviously a wheel of ways that we can manage our stress, some different strategies. Like I said, a lot of these you guys have already mentioned. So there are some that are kind of health oriented. So things like eating a healthy diet and being physically active can both be things that can help reduce our stress. If one of the ways to think about stress is when we're kind of optimizing our health in general, we tend to manage our stress a little bit better. Now, it's important to keep in mind that that's not always possible. If you're someone that has a chronic condition, that keeps you from being physically active or that you have to eat a certain diet for, that may be actually a source of stress for you. So, it's important, again, this is individualized. Find the things that work for you. Getting enough sleep is something I cannot underscore enough. So I'm sure people have had the experience, or at least some people have had the experience of, if you have a really bad night of sleep, the next day, if anything, I feel like the next day, if I get a curveball, it's really hard to manage. And we know that, poor sleep can impact things like our problem solving skills and our decision making skills. So it's not surprising that getting enough sleep is one of those ways to manage stress. Again, there might be things that kind of keep you from doing that, keep you from getting that optimal sleep. But if it's an option for you to kind of protect your sleep a little bit, that can really pay dividends in terms of being able to manage that long-term stress. Asking for help or support from others is another thing that we can do. This can be really hard to do. I think it's easy to kind of put on the screen, but it's hard to actually do in real life. And that's something to consider. If there's like a trusted other that you can talk to about what's going on or that can help you do bits and pieces of your day that might be really stressful for you, that can be really useful. We've talked about using humor. Someone put that in the chat, and that can be so important. It's important to find those humorous moments and to share them with someone if you can, because that can really reduce our stress. It kind of takes some of the heat out of a stressful situation. Um, it's also helpful to do things like communicating our needs, our thoughts, and our feelings. So this could be with a friend or a spouse, but it could also be with a therapist. So if you're finding that, you don't have that outlet, someone to kind of talk to about these things, or you find that the stress is kind of moving into that orange and red zone, and you don't feel like there's anyone there to support you, that's where therapy can be really helpful. It kind of gives you that outlet to do that. I also saw this in the chat. So practicing problem solving. This is, for some people, things like crosswords or phone games, things like that can be relaxing. And so we certainly want to lean into that if that's something that you're feeling. And then the kind of last bucket here are things like mindfulness exercises or deep breathing. If folks haven't tried this, I really encourage you to, especially the deep breathing. I think that it can sound like something that is really hard to get into or something that is really not accessible. And the truth is that even just some simple breathing exercises can help you kind of reduce your stress in the moment, especially for things that are big stressors, but maybe are happen that you have to respond to quickly. Taking a beat, taking a couple deep breaths can be really helpful. And then certainly if you're someone that practices mindfulness, or does things like body scans over time, you can sort of use that as a tool in your toolbox when you find yourself dipping into that kind of red zone. And we'll talk a little bit about mindfulness and breathing here in just a minute. So I do want to also just call out some ways for managing stress specific to mild cognitive impairment. So a part of this is kind of, I think I mentioned this a second ago, but a part of what we want to aim to do is kind of take the heat out of really difficult moments. We can't stop difficult moments from happening, but having compassion for ourselves and giving ourselves the opportunity to move past that and not be defined by things like cognitive slips or memory slips can take some of the heat out of those moments and can actually help move us from that red zone into more of like an orange or yellow zone. So, I don't like the wording here, but trying to accept that memory or cognitive slips are a part of MCI, and frankly, they're just a part of being a human. Those things happen. And having compassion with yourself, giving yourself grace to make a mistake and move past it, to be more than that mistake, is really, I think, can help kind of take some of the heat out of those moments and keep them from becoming more chronic stressors. In line with that, taking things one day at a time. So, it's important to keep in mind that some days are going to be better than others. We want to, kind of capitalize on those good days and give ourselves compassion on the bad days and continue to move forward and try to not let that become a chronic stressor. This is a really important one, both for folks living with mild cognitive impairment and for caregivers, for partners, for spouses. Pick your battles. It's easy for something small to turn into a chronic stressor if you pick it as a battle. So it's important to decide what are those things that are really important to maintaining your life, but also to maintaining your sense of calm, your sense of, is this something that you really want to you know, come to you really want to fight with your spouse about, or you really want to double down on and make sure that, you never make this memory slip again. Sometimes that's really important, right? Sometimes that is the case, and that's something that's worth kind of giving up a little bit of that stress for. But a lot of times it isn't. A lot of times we get kind of sucked into these battles that we don't actually want to be having. So be mindful of that. Pick those things that are really important to you and let the things go that aren't. And then asking for and actually accepting help when needed. I put the actually accepting in here because again, it's really hard to ask for that help and then to allow someone to help you. So keeping in mind that, there may be times that that is the way to kind of reduce that stress is to get a little bit of help. And we talk about this a lot in the cognitive empowerment program, so I'm not going to spend a ton of time on it, but I do want to underscore that we ask for help and we accept help all throughout our lives. And it has a little bit more of it has a little more heat to it, has a little bit more of a sting to it if we're having trouble. So if we're having trouble with memory or something like that. But we've been asking for help our whole lives. And so accepting that help, is something that I think it's really important for us to kind of think holistically about. We may be really good at some things and need help with other things, and it's okay to ask for help if there are things that you need help with. You can become knowledgeable. Here, what I mean is about your own stress. So, becoming knowledgeable about the things that feel really stressful to you or situations that can become chronic stressors can be really important in reducing that stress. It can also be important to talk to other people with similar experiences. So whether that's through programs like the Cognitive Empowerment Program, where you get that opportunity to talk to other people who are in a similar life stage, or talking to others that are experiencing the same stressors as you, right? So if you have I'll keep using my family reunion example, it might be helpful to call other people that also feel stressed about that coming up, to talk about it. And then finally, remind yourself that you're doing the best you can at this moment. So again, this is the idea of giving yourself some compassion, giving yourself the space to make a mistake and move past it, to be more than that mistake. And again, just reminding yourself that you're going to do the best you can in each moment as you go forward. So I want to talk just a little bit for this is, I people have probably heard of some of these techniques, but I do want to talk a little bit about some relaxation techniques and give you guys some resources for this. I think this is particularly helpful for people who maybe don't have as many kind of tools in their toolbox for how to manage stress. And I'm really happy to go into any of these if people have specific questions. But one of the things we can do to manage stress is to engage in relaxation techniques. So this involves kind of refocusing our attention to something that is more calming, that increases our awareness of our body in the present moment. These can include things like practicing mindfulness, which I'll talk about here in just a second, um, cueing words, looking at or doing exercise, doing different breathing techniques, doing something called guided imagery, which is sort of similar to a mindfulness technique, progressive muscle relaxation, meditation, listening to music, or dancing. So, all of these are things that people tend to find relaxing, maybe some more than others. If you're looking at things like dancing or exercise and thinking that does not relax me, that's okay. Pick something else from the list. But these are things that people tend to find relaxing. So this is a good place to start if you don't have some of those tools in your toolbox. And I want to talk just quickly about mindfulness because I think that's something that people can find as it sounds a little bit intimidating. And anyone who's practiced mindfulness knows that it is something that takes practice. But the whole idea of mindfulness is actually so mindfulness is the quality or state of being conscious or aware of something. So the whole idea of mindfulness is bringing your awareness to the present moment. Now, this can be really restorative in mild cognitive impairment because, whether we're someone living with mild cognitive impairment or we're someone who has a loved one with mild cognitive impairment, we're often thinking about the future and the past. So we're thinking about the uncertainties of what's coming And we're also kind of often comparing ourselves to what things used to be. It's not very often that we're staying in that present moment. And that is really difficult for our brains. It's really difficult for us to kind of manage stress when we're comparing ourselves to the past or we're constantly thinking about the future and worried about what's coming. So, actually staying present in the current moment is pretty difficult, and it's something that can be really restorative for us. So, when you hear mindfulness, it's meant to be this mental state where you're focusing your awareness on the present moment while also acknowledging and accepting your feelings, your thoughts, your bodily sensations that are happening. So, again, it's okay if it's kind of an uncomfortable process to say, you know what, I'm going to pull myself out of the future and the past and sit in the present. But the process of doing that can help us to increase our awareness, and it can also actually help us to hone things like our attention. And so, in line with this, mindfulness is helpful for cognition as we can think more clearly and apply greater focus to the information we want to be paying attention to, learning, and remembering. And with practice over time, mindfulness again can kind of strengthen that attention muscle where we become more able to really focus our intentions on the present moment. So there are a lot of benefits of relaxation techniques. So not just mindfulness, but all of those techniques that we talked about. So when people spend more time doing relaxation techniques, we know that they tend to have slower heart rates, which is a good thing. It's healthier to have a little bit slower of a heart rate. It tends to lower blood pressure, slow breathing rate, increase blood flow to major muscles. We tend to see a reduction in muscle tension and pain. It tends to improve people's attention and concentration, tends to reduce anger and frustration, and it tends to boost our confidence in solving problems. So there can be a lot of benefits to engaging in relaxation techniques in addition to reducing stress. So, what I'd like to do now, I just want to give you guys some resources. So, if you're someone that, maybe doesn't have as many kind of tools in your toolbox for how to do these relaxation techniques or ways to manage stress, I wanted to make you aware of some things that are available to you. So there are a lot of online and app-based resources for relaxation techniques. One of them that I like to recommend to patients that I see in the clinic is through the University of California, San Diego Center for Mindfulness. So you can see on the screen, so you can literally just search UCSD Center for Mindfulness, and these resources will come up, or you can use the link on the screen. And they have done a really wonderful job of making different meditations available. So these include things like formal meditations, things like guided imagery, but they also include just brief breathing exercises or things like mindfulness exercises. You can see here there are seated meditations. They have full body scans that you can do, which is like a 20-minute activity. Um, and what I really like about this is that all of this is completely free. So you can go on the website, you can access these, you can listen to them on a phone or a computer, and you can really kind of go through in a way that you can't with other apps and or with the apps that I'll talk about here in just a second, but you can go through and you can try things out. It's not unusual that some of these things are more relaxing than others for different people. So if you haven't tried things like mindfulness meditation or doing things like progressive muscle relaxation or body scans or breathing techniques, this is a really good resource to try some of those things out and see how they feel for you. There are also, as I sort of alluded to, many apps that exist to do this. So if you're someone that likes to use your phone, lots of apps that do this and do it very well. So Headspace and Calm, you can see here on the screen what those look like. Those are available on all of the major phone platforms. And both of those are paid apps, but they do actually have ways to kind of guide you through both individual exercises, so you can pick and choose what you want to do, or you can also take courses so that you can kind of sign up for something that you would do over the course of, 6 to 8 weeks. That would kind of progressively get a little bit harder. So again, those are two paid apps that you can use. There's also a really great free app called Healthy Minds, and you can see that in the top right of the screen here. Same idea. It has freely available meditations, breathing exercises, things like that, that you can access without paying for it. So again, wanted to make these available to you guys so in case you hadn't heard of these things. And again, I really encourage you if you haven't tried, especially things like breathing exercises. Um, they're pretty simple. They tend to be really short, and some people find them incredibly helpful. And especially through these free means, both the Healthy Minds and the UCSD Center for Mindfulness. If that's something you haven't tried before, I really encourage you to give it a shot and see if it's helpful to you. I also just want to take a moment to acknowledge our caregivers. So caregiver stress, chronic stress due to caregiving, is something that we know can have really serious effects on health and cognition for all the reasons we've talked about already. So caregiver stress and burnout is something that is well studied in the literature. And we know that it can lead to things like anxiety and depression, feeling exhausted. We know that our caregivers get sick more often, and that they can experience changes in sleep and appetite. So we always want to be thinking both about, the person living with mild cognitive impairment and also the people in their circle that are helping them. And so, I just wanted to kind of acknowledge that, caregivers, this is something especially to really be aware of, not just the person you're caring for, but also yourself, checking in about that stress and having some strategies online for how to reduce that. Um, all right. So thank you guys for your attention. I'm really happy to answer any questions if people have them. And I haven't been looking at the chat, so I don't know if there's anything there, but happy to talk through any questions we have.
Thank you so much, Kayci. I think, one of the things that's important to remember, like you said, is that we all benefit from some of these things that you offered. It's not just people with mild cognitive impairment, it can be their care partners and their family members, but there is something unique about addressing these issues just for mild cognitive impairment. And it's a nice reminder that it can addressing some of these things. I think the ones that you mentioned, especially things like sleep, are something that can, Dr. Goldstein presented about this from some new research that came out that, when we get our sleep and our stress addressed, our cognition can jump up so like, 10%, 20%. And so it's one of those things that if we haven't allocated the time and resource around, it's nice to remember that we don't have to do those things alone,
Mm.
that there are resources like having a sleep evaluation done and things like that, that your providers, your primary care can help connect you with. And so, as we talk about some of these things with stress, it's also like lifting up some of the stigma around having these conversations, talking to the right people, getting the right resources in place. And what are your thoughts about that on kind of building your care team around addressing some of these stress issues?
Absolutely. So I'm just actually gonna kind of flip us back to the page that has some of those, or maybe I am. There we go. Just so people know kind of what Megan's referring to and can kind of look at some of these as we're talking about it. I actually think a really good first step if you're finding that you're having a hard time managing your stress is to talk to your doctor. So most people that would be like your general practitioner or the person that probably knows you the best. For some people that might be your neurologist. But communicating some of those concerns can be really helpful because this is something, when we hear those things in the clinic, the first thing we're thinking about are, how is your sleep? How's your diet? Are there things that we could help you with? Are there things that you can get a referral for? And as you said, especially if you're someone that's having like a lot of difficulty with sleep, a sleep evaluation could be really helpful. There may be something going on that can be treated. Same thing with, communicating those needs, thoughts, and feelings. Psychotherapy really works. It can be something that it's hard to find a provider that, fits really well for you and things like that. But what we know is that when you go through the work of finding that provider and find someone that you really trust, that can have a huge impact on things like managing your stress. And it gives you an outlet to talk about those things that, is more, is kind of a third party, right? You don't have to talk to your spouse about it. You can talk to someone else that isn't as involved in a situation.
It's,
Um, yeah, go ahead.
you go.
No, I was just going to say the other thing too that I just want people to be aware of is if you are someone who wants to try things like mindfulness or breathing exercises, it is not unusual at all for people to, first of all, you could communicate that to your general practitioner or your doctor, whoever you're seeing. And it's not unusual at all for psychologists or social workers to actually do that with you, to teach you how to do that and to take you through some mindfulness exercises. So, don't hesitate. Don't feel like you have to do these things on your own. Certainly, you can talk to your doctors, or if you have a therapist already, talk to that person. And especially now that, therapy and things like that are available online and are much more accessible than they used to be. It's something it's something you could feasibly probably do like from your living room.
Yeah, there's a lot of resources out there now. People are talking about things like yoga and mindfulness and Tai Chi in
Mhm.
ways that even 10 years ago we weren't talking about it and considering it. Those of you who have been with us for a long time know we have a big old YouTube channel that has a ton of yoga and Tai Chi sessions on there. But what we say is finding your flavor, right? Everybody has their own unique flavor of what's going to resonate with them and their nervous system. And really getting that nervous system back into a place where we can operate sustainably on a daily basis is one of the goals here. So it's something that it's kind of fun to figure out what is it that I need. But a lot of times we may not even know what we need. We may not even know that we have sleep apnea until we go get that test. And maybe we are in bed for 8 hours, but we're not sleeping and getting those REM cycles at all. So just opening up and having those conversations, getting the right resources and the right people on your team, and not going at it alone is something that we really always encourage at the Cognitive Empowerment Program. And I know that we've gotten a lot of people in the chat who are just saying, thank you so much. It was such an awesome presentation, great information. And so thank you so much, Kayci. What we're going to do is take the session and put it on our YouTube page later on this week so that you guys will be able to refer back to it. If you have any other questions or things like that, you can always post them as a comment on our YouTube page, and we monitor those as well. And outside of that, we're going to be back the rest of the month continuing this conversation around stress. If you are wanting to get more active, we're going to be doing a workout session next Wednesday with Ayatoni. At the end of the month, we're going to be doing a little bit more Tai Chi. We're also going to be talking about the mind diet. So if these are things that are part of your goals, please continue to join our community as we continue to really have these conversations and uplift what is the best, most loving thing I can do for my brain. And Kayci, thank you so much for sharing your expertise as we figure that out together.
Thank you all for being here today.
Thanks, everybody. Enjoy your afternoon, and we'll see you all next week.